Okay, so guys, particularly my Beret class, I'm really, really sorry that I'm not here to take you for this lesson, but if you just follow along to this PowerPoint, you will be done with content in this double period, okay? So the first thing we're going to do is I'm going to take you through the gas questions with perfect structures that you should have done for homework on Wednesday, okay? So this was just the sheet that I gave you. So we're looking at the first question. So when Daniel hears his school teacher tell the class to clear the table so they can complete their sack, he suddenly realizes he forgot about it and his heart begins pounding rapidly. What stage of the gas is Daniel most likely experiencing? This is 2 marks. So when this is 2 marks, what we want to do is we want to identify, can't spell identify, and make a justification. So if we're looking at the keywords, we can see that his heart has started to pound rapidly. So that can only lead us to counter shock. He has perceived the stressor, which occurs in shock. And in counter shock, that's when we have the initiation of the fight-flight response, activated by the sympathetic nervous system, okay? So when we're justifying, what I want you to say is make sure that say the sympathetic nervous system or the fight-flight response is activated to give the body energy to overcome the stressor, okay? So you need to make sure you've got both points and each of these are equal to 1 mark. Okay, the second hot question is a bit bigger, okay? This includes some really important structures, okay? More specifically, I want you to be aware of B and C. Okay, but let's go through all of it. So Tasha is a doctor in a busy general practice. Tasha returned to work after 6 months maternity leave to a very busy flu season, I think that says, that required working 12-hour days to cope with the extra patient load. As well as being very busy at work, Tasha missed her baby son. After 6 weeks of this workload, she developed a severe tension headache by the end of almost every working day. After a few days, Tasha's headaches went away, although she was still working long hours in the busy surgery. When she caught the flu herself, she had to take a week off work. After recovering and being back at work for a few days, she was unable to get up and go to work one morning. When she consulted her own doctor, she was diagnosed as being extremely stressed and physically drained. So there's lots going on in that scenario. And we can certainly see where she's going through resistance and exhaustion. So when we're looking at these kinds of scenarios, I always just kind of like to draw a little diagram with gas, and so we go, woo, and that's not very good, but you get the picture. All right, so which stage of gas was Tasha most likely in when she contracted the flu? Now remember, the flu is pretty serious, okay, but is she able to cope? At the start, the answer is she can probably cope. So in terms of the gas model, she's probably like here, okay? So she's coping. But then when she kind of can't get out of bed and she's like physically drained, she's not coping, okay? So because she's decided it and she kind of can go to work and stuff, she's in resistance, okay? So it's just 1 mark. Now, B is really, really important, okay? I really want you to know this structure. When we're talking about like illnesses, getting illnesses in terms of resistance or in terms of exhaustion, it doesn't necessarily matter. There are a few points I want you to hit, okay? And in this this kind of structure, these are the 4 points I always want you to hit, regardless of the marks given, okay? So when the person is in resistance or in exhaustion, I want you to make sure that you're saying that stress hormones or cortisol, and you should be more specific, I will say, are released during the resistance stage to fight the stressor, and give me examples, okay? So in the first point, you talk about your stress hormones, cortisol. You're identifying the stage, whether it be resistance or exhaustion, and you are explaining what the stress is. So with this one, we're talking about the 12-hour work days. Okay, that's a huge stressor. Sorry for my terrible handwriting. So the stress hormones remain at a high level for a long period of time. Okay, or you can say they remain at a high level for a prolonged period of time. Now, due to this, immunity is suppressed or reduced, okay? And this means that Tasha is more susceptible to illnesses such as the flu, okay? So, in terms of our 4 points, cortisol is secreted during the resistance or the exhaustion stage to fight the stressor, i.e. Tasha's 12-hour work days. Consequently, prolonged exposure or secretion of cortisol means that the immune system is reduced or immunity is reduced because it is fighting the stressor. This makes Tasha more susceptible to illnesses such as the flu. Okay, so just make sure you're including that whenever you're talking about why someone has a flu, or if they have a heart attack, or anything like that. Now, if they have just a cold or a sore throat, again, they're probably creeping up here. So that's exhaustion, sorry, resistance. If they're down here, that's when you're more likely to see things like heart attack, ulcers, the flu, depression, anxiety, and all that really bad stuff. So in terms of psychological problems that Susan may experience, we've got things like in the final stage of sorry, we've got anxiety, depression, nightmares, sexual dysfunction. Honestly, guys, the best ones to use are your mental disorders, okay? Anxiety and depression. Just use those. They are a sure sign that there is, the person is in exhaustion. And lastly, explain the role of Tasha's sympathetic nervous system in stage 3, which is obviously exhaustion. This is 2 marks. So we know that sympathetic nervous system releases hormones, i.e. cortisol. And the SNS attempts to maintain high arousal through this stage to deal with the stressor. Although it's obviously not very effective given that all of the resources are depleted. Now remember, B is the important one, so please remember that for me. Okay. Question 3 is just the diagram. Now, pretty much the things I want you to remember is you may need to draw this in the exam, okay? And your diagram may not look like this, so you may not get like all of the nice stages kind of like labeled and like drawn out for you, okay? Just make sure that you're doing a few things. Make sure you're giving me the axes, resistance to stress, and you're drawing the line. You're giving me the time and the 3 stages, alarm, resistance, exhaustion. I would also suggest that you pop in your little dotted line and you divide the first stage into shock and then counter shock. Now, VCAR is not going to be like super crazy about your curve in terms of how tight they're going to be. Like generally they'll give you a mark for the general trend, okay? So you're going to start here, okay, you're going to go down and up, then down there, okay? So that's kind of what it's going to look like. So just to remind you, I think this is like normally 3 points. So you've got the axes, sometimes the title, and the trend is kind of what we've seen in the past. So just things to remember, but just remember you need to know this diagram. Okay, the last hot question. Suzanne suffers a heart attack. That is bad. She is exhausted. Her husband blames this on prolonged stressful environment she's experienced at work. According to GAPS, there's a series of stages that we go through in response to a stressful situation. So what is now the final stage? We know it's exhaustion. briefly explain how Suzanne's physiological arousal due to stress can both help and lead to problems. Okay, so you've just got one for each. Now, in terms of the help, we're literally just talking about the role of cortisol, right? So, in terms of cortisol, we know it's a stress hormone. This repairs the body and speeds up the healing process. It also maintains arousal to help the body fight the stressor. You need to make sure that we've got repairs the body or maintains alertness to help the body fight the stress. Okay, so this has to happen together. Those two belong together. These two you can choose either. In terms of the heart, we've got lots of different things, okay? So you've got a few things. So pressure on the heart, it leads to heart disease or attack. So just think like if your heart rate, it has increased for like a period of over a year, your heart muscle is pretty fragile and so it can wear out, which leads to heart attacks, okay? The one I like best is this second dot point here. The body's immune system has been weakened, which means that she cannot resist further infections, okay? So it means that she's more susceptible to illness, such as illnesses such as infections and things like that. Okay. Okay. The main one is question 2B, I think, in terms of the structures that you're more likely to see, but certainly pop these into your hot bank for me. Okay. I want you to take some time now and just somewhere in your books or on your computer, I just want you to compare and contrast Gass to Lazarus and Folkman's model of stress and coping. Okay, so what I want is I want you to try and get at least 2 similarities and 2 differences for me. Okay. So hopefully you have taken some time and you've thought about 2 similarities. Oops, no, that did that. And 2 differences. Okay. So in terms of the differences, Lazarus and Folkman is obviously the psychological focus of stress, whereas Sully is the physiological reactions. Lazarus emphasized stress is subjective, whereas Sally emphasized that stress is the same. The model for Lazarus is based on humans, whereas Sally based his model on rats. These two are the easiest. Okay. In terms of the similarities, both do not consider environmental or cultural factors, and both acknowledge positive and negative stresses, i.e. eustress, distress. Okay, I like this one the best. Okay, so we are now moving on to dot point 9, which is our last dot point. Yay! So once you've learned this, that is actually it in terms of the content, the stress and nervous system, and you can move on to your summary notes, which we'll talk you through at the end of this, explain everything. Okay, so I'm obviously not there, and I know you guys are probably going to talk through this whole thing anyway, but maybe talk to the person next to you if you can, or even just consider how well you cope with certain stresses. Okay, so think about like these stresses down here and think about what will you actually do to cope with them. And I kind of want you to consider like if your strategies are going to help you to cope or if they're going to actually hinder in your coping. So like, I don't know, if we're talking about having lots of work for your SACs, right? So if we talk about strategies that help you to cope, you might consider things like making a study timetable. That's going to help you to cope. You might consider exercising to kind of like take down that stress response, or meditating. That might be a good way to kind of like calm your mind prior to a SAC, okay? In terms of things that might hinder your coping, you might procrastinate, and that's clearly not going to help anybody. I can't even spell procrastinate. Classic. You might just get really, really drunk the night before the SAC. And obviously that's clearly not going to help your understanding or your learning, okay? So I want you to consider one of these and just like think about like overall when you cope with your stresses, are your coping mechanisms, are they more positive? So do they actually really help the stressor itself? Or are they actually more negative? So do they actually kind of like make everything a little bit more worse? Okay, so just consider that, because when we talk about this stuff here, this is a really nice kind of dot point to help you understand what you do to cope, and how that may or may not be, I suppose, the best thing to do in the long run for you guys. Remember, I spoke about the initiation of the GAS model, and we know that if we have good coping mechanisms, that we're actually much less likely to feel as stressed in comparison to someone who does not have good coping mechanisms. Okay, so grab out the notes that I've given you, Berwick class. I will have given these to you the day before, so Thursday. And if you need these, I'll leave some copies on my desk for you. Okay, so they'll just be in my office. All right, so let's talk about coping. So coping is a process involving cognitive and behavioural efforts to manage specific internal and external stresses that are appraised as exceeding the resources of the person. So a coping strategy is a specific method, whether it be either behavioural or psychological, that people use to manage or reduce the stress produced by a stressor. Okay. Now, the thing to understand is that we're all individuals and we all use a different combination of strategies to cope in any given scenario. So there's no single right way to cope. It may actually depend on a lot of factors like what is the scenario? What external and internal resources do you have? How has your past experience informed your coping mechanisms and things like that? Okay. There are, however, different factors that influence the effectiveness of these strategies, okay? And that is like the nature of the stressor, the individual, past experience, and the stressor itself. And we'll talk a little bit more about that later on. Okay, so the nature of the situation. So people with good coping skills can evaluate which would be the best coping strategy for each situation, and they're also able to change strategies if they need to. People with good coping skills tend to be more stress-free and happier, and they tend to also have a positive overall outlook than those who maybe don't know how to cope with their stresses, okay, or which ones might actually work best for them. So what people with good coping mechanisms know is they understand that one coping strategy that works well in one situation may not necessarily work well in another situation, and that same coping mechanism may actually kind of like be counterproductive. Okay. So what we need to know is that the effectiveness of any coping strategy can be influenced by the demands of the situation, the ability to adapt and modify the strategy accordingly. Okay, so what we kind of look at is these two things called context-specific effectiveness, which is when we look at a situation, we go, okay, well, which is the best way or the best strategy for us to cope in this situation? And then we look at coping flexibility, which is this idea of that, well, if we've kind of chosen this coping mechanism or this coping strategy and it's not working for us, we might go, okay, we'll probably need to change the way we're coping now to make that mechanism a little bit more effective for the situation. Okay, so when we can choose the correct coping method and then change it if we need to, this means that we're much more able to cope with stress than people who can't do those two things. Okay, so let's look at coping flexibility. Coping flexibility is the degree to which a coping strategy or combination of strategies is successful in alleviating stress. Okay, so if we have flexibility, what it includes is the ability to evaluate a coping strategy. So, is this working? Modify an existing strategy. How do I make this better? Discontinue an ineffective coping strategy. I'm going to stop doing this one and I'm going to try something new, and implement an alternative coping strategy. Okay. So this is kind of what I mean. Let's say, for example, we've got our SAT coming up pretty soon, right? And so let's say that your coping strategy is like, all right, I'm just gonna study by just I'm gonna read through the textbook over and over and over and over and over. Okay, and that's how I'm gonna study for the SAT, and that's gonna how you're gonna cope. So you get into the SAC and you do that and you get your results back and you haven't done very well. In fact, you've only just passed. And you think to yourself, well, the way I dealt with that stressor, that study of the SAC, it probably wasn't super effective. Okay. So what you might go, so you evaluated that stressor going, okay, well, it wasn't great. Okay. How am I going to change what I'm doing to make me get better results? And so you might modify the strategy or you might just continue with the strategy. So if we're going, okay, well, maybe just reading the textbook isn't ideal. Maybe what I need to do is read the textbook, make some summary notes, and do some practice questions. So now what you're doing is you've modified that overall coping strategy to become more effective. So next time you hopefully will get better results, okay? So we're looking at our coping strategies going, is this working? Is it not? If it's working, that's great. Okay, we'll keep doing what we're doing. If it's not, how do we change it? Okay. This is adaptive. The reason it's adaptive is because when we experience different stresses, we can go, okay, well, we're going to change our coping strategies for the specific stresses. We're not just using like the same kind of coping strategy. So not everybody is able to kind of like have good coping flexibility. We have people with high coping flexibility and they can readily adjust their strategies to suit a situation. They use a variety of strategies for different situations. Their context-specific effectiveness tends to be high and they experience much lower stress. We'll talk about this in the next slide. There are also people who don't have good coping flexibility. Theirs is low. So what happens is they use the same type of strategy across different situations, regardless if it is effective or ineffective. They continue to persist with an ineffective strategy. Their context-specific effectiveness tends to be lower and they experience high stress, okay? So what we're saying is if you are adaptive with your coping strategies, that equals less stress. Okay, let's talk about context-specific effectiveness. A coping strategy, regardless of what it is considered to have context-specific effectiveness when there is a match between the coping strategy that is used and the stressful situation. So the coping strategy has to consider the stressor, the environment, so the circumstances or context of the situation, and the individual things. So things like personality, knowledge, skills, interests, preferences, access to social support, and things like that. The coping strategy must match individual characteristics of the person and be appropriate for them, okay? So if, for example, you're stressed due to an exam, planning, time management, and study might be beneficial, but like not thinking about the exams, but also like distancing yourself from it or wishful thinking while engaging in minimal study would probably be relatively detrimental, okay? However, if you were just like waiting to get results back from your exam, mental distancing or distraction is probably going to be much beneficial when waiting for the arrival, okay? Because that's kind of like going to reduce your emotional response. So in some scenarios, what might work for one thing is not going to work so well for another, but something that might be counterproductive for one situation might be the best kind of coping mechanism for another one. Okay, so let's have a look at like this thing here. Okay, so let's think about some effective coping strategies and ineffective coping strategies if you're looking for a new job. So in terms of like ineffective coping strategies, probably just like procrastinating is probably not going to help you very much. If you like put on Facebook, like, hire me, I need a job, then that's probably not going to be like super effective. If you aren't proactive and you just kind of like sit around at home, or I guess procrastinate, or like you just go for a jog every day rather than actually like prepping your CV and things like that, or go to interviews, then that's probably like not going to be very good as well. Okay, that's probably not going to help you to get the job. So this would not have context-specific effectiveness because these strategies don't actually match the stressor, the environment, or the individual, okay? Now, if, for example, you updated your CV, you handed out your CV to potential employers, you did a course that would upskill you, then these are probably going to be strategies that are much more effective for the stressor itself. So these kinds of strategies are more likely to have context-specific effectiveness. Okay, so we've talked about like whether a strategy is going to be effective for reducing stress, okay? And so first, we must look at if there is context-specific effectiveness. Now, if our strategy has context-specific effectiveness, it matches a stressor, then it will reduce stress. If that's not the case, what we might want to think about or what we might need is coping flexibility, okay? And so we might go, okay, well, our coping strategy isn't working so well. We might change it, or we might like integrate or introduce a new strategy. Now what we're going to look at are specific strategies for coping, okay? Now I'm going to talk not very long about each of these, but I'm going to talk about how you can link these strategies to other parts of this unit as well. So first and foremost, one way that we can reduce, the one way that we can reduce stress is through exercise, okay? Now this tends to be a physiological answer to stress, but you must also consider the psychological benefits of exercise as well, okay? When you are looking at exercise in terms of how it's going to reduce your stress, I want you to think about two things for me, okay? I want you to think about what is the change in the body, and then how will that reduce stress? Okay. So we know what exercise is. There's like a million different ways to exercise, and I think the best one that you're meant to use to reduce stress is aerobic. Okay. There are a few things, and I'm going to show the ones that I like the best. Okay. I'm going to show you what the physiological ones are and what the psychological ones are. So in terms of physiological ones, the first one is it reduces stress hormones. It uses them up, which reduces the experience of stress. Okay. So this is a good one to use, okay? So this is the change, reduces hormone levels, and this is the effect on stress. It reduces the experience of stress, okay? This is my favorite. So it releases endorphins, which is the change in the body, okay? And that improves mood, which is how it reduces stress, okay? You can also say it helps to reduce muscle tension, which helps to reduce experience of stress. It increases the efficiency of the cardiovascular system, which increases strength and stamina, okay? So we've got the change in the body and how it reduces stress. This last one here is psychological, okay? So it acts as a distraction or a timeout from a stressor, and that will reduce feelings of stress. Okay, so this is just a psychological one here, okay? The rest are physiological. So in terms of other kinds of strategies, we have approach strategies. Now this is a word perfect definition, okay? So this involves effort to confront a stressor and deal directly with it, okay? This is really important. This is really important. Activities focused towards the stressor, its causes, and a solution that will address the underlying problem, okay? So what you're doing is you're fixing the problem, okay? The good things about approach strategies is they involve a change in behaviour and it's viewed as a healthy or an adaptive way to deal with stress. It allows the individual to feel in control of the situation and it's more adaptive and effective. Okay, why? Because we're dealing with the underlying source of stress. Now, initially, this may increase stress levels when they are engaging with a stressor, and it also may require a lot of the individual's energy, which means that they might neglect other aspects of their lives. Okay, so we're looking at things that are going to change that source of stress. So approach strategies are things like if you lose your job, then you hand out CVs so you can get a new one. You might take a course so you can develop more skills. When you're studying for an exam, you're going to make a study timetable. You're going to do practice exams. You're going to hand them in to your teacher for feedback. And then when they give you feedback, you fix your mistakes. Now, all of these are very healthy and they might help you to feel in control of the situation. And overall, they might be the best thing to do rather than like just getting drunk every night. But when you're doing those things, like you're doing exams, you're responding to feedback, you're giving them to your teacher, and you're waiting for your teacher to give you feedback, that's time consuming. Okay, and because you're so intent on studying, you might maybe neglect other aspects of your life, like spending time with friends and family. The other one that is in direct, not competition, but in comparison to approach strategies are avoidance strategies. Again, word perfect definition. This involves efforts to evade a stressor and deal indirectly with it and its effects. Okay, our activities focused away from the stressor, and we do not actively confront the stressor and its cause. What we do is we use things to eliminate the feelings or the emotions to do with stress, okay? So if you're stressed about an exam or the fact that you've lost your job, you might go for a run to kind of reduce those feelings of stress. You might meditate to reduce those feelings of stress. You might binge eat or go shopping, or you might just go to sleep to reduce those feelings of stress. So you're not actually dealing with the cause of the stressor, you're just dealing with your emotions that are associated with the stressor. Now, avoidance may be a necessary technique so you can focus on stresses that you have the potential to change. So like if, for example, a loved one has a terminal illness, then you can't really change the outcome. So the only thing you can really do is focus on your emotions or other kinds of things that you can control. This can also be good for short-term relief, but if they're used for too long, they do prevent people from responding to stresses in constructive ways, okay? So like if every time something bad happens to you, you go out and get drunk, well, it's actually not going to help you to like deal with like any kinds of stress in your life, and that will just be cumulative, and then you might end up getting a stress-related illness. In terms of negative approaches, it tends to be maladaptive, okay? What it doesn't do is it doesn't really help you to deal with the underlying cause of the stressor, okay? Which in the short term is maybe more I guess acute in terms of stress, but in the long run, it does reduce the stress and it also increases your resilience. People who use these strategies are more likely to suffer from stress-related conditions. Why? Because they're not really effectively dealing with the underlying stress. Like the stressor is still present, so they're more likely to have that stress response. So I'm going to send you these clips, and so you can just watch them. They're just fun, like little Mentos ads. But you can just have a look and see if you think these are approach or avoidance strategies. One thing I do want to kind of mention, and this is really important, is that when we talk about approach and avoidance strategies, we link these to Lazarus and Folkman, okay? So remember in Lazarus and Folkman when we talk about like the secondary appraisal, we talk about like evaluating our coping resources, okay? Those coping resources might be like your approach or your avoidance coping strategies, okay? So we'll do a bit of work on like how we might connect them in revision, okay? Okay, lastly, this is going to be your homework for the weekend, okay? If the rest of the days sorry, I'm really struggling. For the rest of today's class, what I would like you to do is I'd like you to use these notes and maybe read through your textbook and complete this thing here. So complete question 2, 3, 4A only, 5B only, and 5B and C, okay? So please do those for me. Complete booklet activity 16, which is just a bit of revision. And then what I'd really like you to do is I'd like you to take the revision booklets, which I'm hopefully have already given you or the sub has given you, and I want you to start your summary notes. In the revision book, there is going to be a checklist of I guess key things that you need to know, but you can just look through your notes. And what I want you to do is I want you to kind of like organize it in a way that makes sense to you. Don't just copy what I've got in my notes, reduce it. Focus on what your definitions are, what good examples are, what your key words are, and organize it in a way that makes sense to you. You can do a mind map, flashcards, or a word summary, but you all need to summarize your notes, okay? And that's what I want you to do for Monday. All right, if you need me, you can email me. I have a bit of a hectic weekend coming on, so I probably won't be able to email you back until maybe Sunday night if I'm lucky. I will try my best, but I can't promise anything. All right, guys. Be good. All right. Thank you very much.